World Patient Safety Day on the theme Engaging Patient for Patient Safety was observed at the auditorium of SHIJA hospitals today. Head of Secretary Department RIMS, Dr. R.K. Lenin, Registrar of Manipur Nursing Council, Dr. 𝗪𝗪𝗟𝗏, Chairman cum Managing Director of SHIJA Hospitals and Research Institute, Dr. 𝗪𝗪𝗥𝗟𝗚, doctors and nurses of other private hospitals attended the observance. Speaking on the occasion, Dr. R.K. Lenin stressed the importance of observing the patient's safety to understand the relation between patients and those in medical profession, stating that patient safety lags behind in developing countries in comparison to the developed countries. He said that different factors including infrastructures account for a standard healthcare system besides the capability and competency of doctors and nurses. He also expressed need for doctors and nurses to deal with the patients with care to ensure improvement of patient safety, adding that in a developing country, it is often the case that 1 of 10 patients is left unattended. Chairman cum Managing Director of SHIJA Hospitals and Research Institute, Dr. 𝗪𝗪𝗟𝗏, also spoke about the significance of World Patient Safety Day.
Loinana media gi chilinaw sing koigi amsugi foundation yauba thengtharaga ngaibiramagi damakta hanna thagachari message kharadang koi public te honjibanga magadi asi pangthokchariba program asi maipa e haina logjagadoribani akoi patient safety gi maramda kari gi miktamakta ngangnariba nomadi WHO na world gi khwaidagi makok thonglaba organization sina karigi magi pandam singi manungda masi ama oina thamaino haibasi matangda aikoi developing countries kana developed countries agi khara hela shoi healthcare haibase doctor nurse ki wasing quality quantity magi capability magi competency si khaltana on me ade ngasi di yamna surprisingly aikoi maternal mortality rate infant mortality rate kasi aikoi lamdamna yamna wangkhalaiba mayamna prize ga piresi yamna angakpani masida akoi healthcare workers singi koi dedication yaudab nate aduga koi patients singi akoi immunity level sisu yam kwang matai aduga isorna so koi bu chambiram matai hana khanje
bajikti taseng badi golden era ne anabasi khangaga lai adu kaisu lot pasu yaro adu data mayam si loina leiba aina sida changiba data si delhi da dum uya bagi adugi electronic data nasigi tawdeya de hana India government is kana tawri loina universal health अब याम कना संगल ऐसी इंडिया की याम कना लाइंग बसी affordable ओइना बायना मारो हेल्थ याम कना फोकस से तंग नरे आना हाइबा हेल्थ केयर की एस्टैब्लिशमेंट में आसी मागी प्रोफेशनली कोई मैनेज तौरगा अना बगा एंगेज तौरगा अना बगा खंगमिन नरगा प्रजा खंगमिन नरगा अकोई खुसम नना सबमिन नरगा दी अकोई ने पाम दब थुगुक में आमसी याम हंदगनी मखाता ब डेलिब्रेशन होगिबा आने की में आमसी दगी याम साउबा कोई नॉलेज की इन्वेस्ट तौरने खली